Hi, my name is Deontay Potter, and the population that I've chosen to work with is troubled youth. Specifically, I like to work with African Americans and troubled youth because growing up, I witnessed a lot of unsafe living conditions, assault, and violence, and I am not a product of my environment. And I would like to show others that they don't have to be a product of their environment either. The increased crime rate is another factor in why I've chosen African Americans troubled youth because although from 1996 to 2006, the crime rate has decreased 75%, among African Americans, we still lead in sexual assault, murders, and gang related violence. And I just figured I should be the voice of reason to show that you do not have to use that kind of lifestyle to get by. What is troubled youth? The term troubled youth is used to define various behaviors or emotional problems among adolescents. Some troubled teens have mental health issues like depression or ADHD that may affect their daily lives. The therapy that I researched that's best for troubled teens is the behavioral therapy, specifically the operant conditioning and the social cognitive theory. In operant conditioning, behavior can have certain consequences. So for every action, there's an opposite or positive reaction. So with positive and negative reinforcement, we can either give the troubled teen something that help boost this behavior or take away something that the teen does not want that ensure that this behavior continues. For punishment, this works the same but opposite. If there's a bit undesired behavior, that we could give them certain punishments that will be sure to extinguish this behavior. Social cognitive theory is all about environment, personality, and behavior. Clients learn based on observing others, meaning with troubled teens, if they see someone getting fast money or they're looking up to the wrong kind of role models, they think, yes, this is how I'm supposed to be in this lifestyle, and this is what I need to do in order to survive. Techniques for behavioral therapy. Some of the basic techniques for behavioral therapy is counter conditioning, positive reinforcement, shaping, modeling, and extension. One of the more well-known techniques for behavioral therapy, eye movement desensitization and reprocessing. And with this technique, one may go through a traumatic event such as being robbed or sexual assaulted, and they keep reliving it, and every time they do it, they're traumatized. With this, they'll have the client think about what traumatized them while they follow your finger from one side of their face to the other side of their face. And while they're concentrating on what traumatized them, this tends to lessen the emotion that the client feels from the traumatization. Dialectical behavioral therapy is normally used when a person uses intense emotion out of the ordinary. This is normally happens during relationships is when a person is most vulnerable. And the way to counteract this is to show mindfulness, interpersonal effectiveness. Like, let's say someone has borderline personality disorder and they have to weigh being too assertive and being passive. They have to be able to set those boundaries. And distress tolerance. They have to be able to bear the pain skillfully by either distractions, improving the moment, weighing the pros and cons. Emotional regulation, they have to be able to identify what can change his or her emotions. They have to be able to increase positive emotions through events. They have to be able to take the opposite action that's going to inflict a negative emotion towards oneself. Observational learning. The social learning approach. Albert Bandura did an experiment in 1961 which had to do with 72 children. 24 of these children had aggressive role models. 24 of these children had non-aggressive role models. And 24 of these children had no role models. The 24 children with aggressive role models were set in front of a TV screen and would show these aggressive role models hit a Bobo doll. And the Bobo doll, as they hit it, they would either hit it with weapons or they would hit it with their hands, and the bam, pow letters would appear on the screen. And when they placed all 72 of these children together, they found that the 24 kids who had the aggressive role models would play more aggressively with the other children. And taking this a step deeper, in Witherspoon 2010, they did a study where 564 children ranging from the ages of 7 to 11 found that they were more vulnerable to TV advertisement than the older children. And which shows that the younger that we are, the more impressionable we are to certain shows. Ferguson 2011 found that there was a correlation between the environment that we are in and the type of entertainment that we used to watch. So if we're in a violent environment, we are more likely to want to watch the violent shows, which means, and taking this in consideration with YouTube and the mobile devices that we have now, the role models that our kids are currently watching can influence them greatly on their behavior that they throw out in school. A secondary therapy that I found would be efficient with troubled youth is existential therapy. And existential therapy has to deal with freedom and responsibility, self-awareness, formation of an identity. Who do you want to be? What do you want to be remembered for? Who are you? The fears in this therapy is isolation, meaninglessness, death, lack of a relationship, and guilt. And looking over the fears in existential therapy, I just remember the stories I've heard from people who was incarcerated telling me about what they think about every single day. The goals in existential therapy is to find purpose and meaning in life, increase awareness about choices, bring better understanding to themselves and their values, improve communications, responsibility for decisions, and to be completely honest with yourself. The multicultural perspective of behavioral therapy says that there's a lack of responses to specific issues, such as social justice issues, meaning that maybe an individual has had a conditioned response to be a certain way throughout the duration of their lives, like act a certain way around a group of people based on their upbringing, which may be harder than the average person to extinguish. For existential therapy, it doesn't take into consideration the circumstances of maybe oppression, or an individual may feel as if there is no way out. I can't improve myself. I am being honest with myself. This is it for me. And it's harder to bring them into the positive outlook of their lives based on the circumstances of their upbringing. There are definitely other races with low incomes that I will be willing to help. For example, with other races, I'm pretty sure I would use the existential therapy because I would have to be patient and show genuine empathy and to try to understand the client's experience by no direct attempt to change what he or she may have been going through, just to guide them towards a positive future. The end goal is to invite greater honesty, improving the next generation by being a helping hand, listening, steering them into the right direction to a better future for tomorrow. And these are my resources. And thank you.